Good morning everyone. The title of my study is Choroidal Thickness Measurement Using Enhanced Depth Imaging OCT in Pediatric Population. Now, choroid being the most vascular tissue in the eye plays an important role in pathophysiology of various ocular conditions. And newer imaging techniques like Enhanced Depth Imaging OCT has improvised the visualization of chorioscleral interface, which helps in detection of the choroidal thickness clearly. The eyes of healthy children differ from those of adults, and the influence of a normal developmental process on the choroidal structure can be evaluated by determining choroidal thickness in children of various age groups. The aim of this study was to measure choroidal thickness using AIOC2022 and to see its variation with increasing age and with different refractive errors. The study was spanned over a period of 1 year. It was a cross-sectional study and it included 300 pediatric patients, that is 600 eyes. All children walked-in patients in the pediatric OPD from 5 to 18 years with or without refractive errors were included, and all pathological eye conditions were excluded. Complete ophthalmological examination was done and choroidal thickness was calculated manually from the external surface of RP to the chorioscleral junction under the fovea, as shown in this image, where we drew a perpendicular line under the fovea from the hyperreflective line. Hyperreflective line suggests the retinal pigment epithelium, and it was extended up to the chorioscleral junction, which is clearly defined in the ADI mode. So we found that the mean choroidal thickness in Indian population in this study was 378 microns, and the association between choroidal thickness and age was clinically significant with a negative correlation. When coming to refractive errors, the association of emetropy and choroidal thickness was also clinically significant with negative correlation. But in myopia, though the correlation was negative, but it was not clinically significant in this study. Comparing other similar studies, Tenlik et al. In a Turkish pediatric population found the mean subfoveal choroidal thickness to be 388 microns. Bidot Garner et al. Found it to be 341 in French pediatric population, and Park et al. Found it to be 348 microns in Korean pediatric population. The mean choroidal thickness in our study among emetropes were 415 microns, which was higher than that in myopes, that was 372 microns, clearly suggesting that myopes had a thinner choroid. And no association could be established between choroidal thickness with hypermetropia or astigmatism in this study due to limited number of subjects and unequal distribution among each set of refractive errors. So to conclude, the mean choroidal thickness is more in younger age group. The choroidal thickness is correlated negatively with age. When seen in emetropia, it also has a negative correlation with age, but in myopes, though being negatively correlated, we did not find a clinically significance in that because myopes have a thinned out choroid and it does not get thinner with growing age significantly. And no association could be established between hypermetropia, astigmatism and choroidal thickness. Thank you.
Did you see any association with amblyopia?
Ma'am, amblyopia were excluded.
Okay.
All
Myopia.
Myopia was clinically, there was a negative correlation, but there was no clinical significance found in this study. The children with myopia at 5 years were also having a thinner choroid, and 15 years also had a thinner choroid. So there was no.
But you didn't take anybody with LD, with low dose atropine, no?
No, ma'am.
That would be interesting. After this, you do that and see
Okay.
what happens to the choroid in the same. This will be your control group. At least age match to see what happens when the patient is on low dose atropine.
That'll be interesting to see.
But this is your same control group. You could use this as.
Great. Nice presentation.
Thank you.
Thank you.